Hello and welcome to the Third Sector podcast. I'm Lucinda Rouse.
And I'm Emily Bird. Each week we bring you half an hour of discussion and debate about the important goings-on in the charity world. This week we're going to be talking about the importance of trust in the charity sector. And later on in Charity Changed My Life, we'll hear about the impact that the Rebound with Rovers mental health programme had on its first ever participant.
But going straight into this week's main discussion, we're going to focus on an issue that repeatedly comes up in talks about the voluntary sector.
Trust in charities, I think, is at around 55%. We saw that when there's that increased trust geographically, there was an increase in donations.
So it was targeting Africans who needed a charity like World Vision, which is reliable, trustworthy, impactful, that they also could use in terms of investing back into the region.
And that culture of safety and trust enables people to have the time and confidence and, quote unquote, the permission to go and explore, but actually to tell us about it.
It's all based around trust and trusting your volunteers that they're going to do a good job. And if you don't trust them, again, take a step back. Why? And do you need a conversation with that person?
If you have trust, then things just work so much better. But the problem with building trust is it takes time, and often donors don't have that much time, and charities also don't have that much time.
I think because of that, they can establish trust. They can establish trust with people who are not trusted by or trusting of society.
There we had excerpts from 6 episodes of the Third Sector podcast that we have recorded since the beginning of April. Our guests were talking about a broad range of topics, from public trust for charities, mutual trust between charity leadership and staff to try out AI solutions, winning the trust of philanthropists, trust between charities and their volunteers, and perhaps most important of all, the need for trust between charities and their service users. For this discussion about trust, we are delighted to be joined in the studio by David Welch, the Chief Executive of the Kent, Surrey and Sussex Air Ambulance. He's also a trustee of Air Ambulance UK. Hello, David. Thank you very much for joining us.
Hi there. How are you?
I'm very well, thank you. So, which of those areas that we've just touched upon, which of those ring most true to you at KSS?
I think, to be honest, all of them. Trust is absolutely fundamental to every charity, and the relationships that it has with its staff, with its volunteers, with its stakeholders, and with its patients or beneficiaries. And I think, to me, if you have a breakdown of trust in any one of these areas, you've got a problem. You know, trust is something that we talk about, but you can't just have trust. You have to earn trust, you have to build trust, and you have to maintain trust over time. And I think there's so much that kind of underpins that, but the fundamental things to me are about transparency, being open and honest with your donors, with your staff, with your volunteers, with your beneficiaries. You know, when things go well, then you celebrate that success and you share that success. But when things don't go well, it's okay to bring that to people's attention and manage the situation so that you're being transparent about something that may not have gone according to plan. So I think, in all these relationships, trust is really important. And at KSS, we work really hard to build and to grow and maintain and develop that level of trust. I think as well, trust is a two-way thing. We have to trust, the people that we are working with, whether it's staff, volunteers or beneficiaries, they have to trust us, as the same goes for all our wide range of donors.
Yeah. And so just putting that into practice and hearing about some of the work that you've been doing at KSS recently, You have accomplished a pretty major fundraising feat. Could you tell us about that and how trust played into its success?
Absolutely. So without going into all the details, because it's quite a long story, back in December, we kind of realised that, or we were made aware that our aviation partner was potentially going into administration. And over December and right through to the end of January, we had to work with the administrators and the new company that were coming in to get the best outcome for KSS and our patients. And we were facing significant cost increases. But what we did is we managed to negotiate these cost increases into something that was still more expensive, but better quality service and more affordable. We also managed to negotiate as part of that the opportunity to buy one of the aircraft rather than lease it. And buying and owning your own aircraft is a much more cost-effective way. And that was going to save us £486,000 a year. So that was a really important thing for us to do. And we took the opportunity to do it. It was a time-limited opportunity, so we had to complete that by the end of June. So we set about in a very short period of time developing and launching a fundraising appeal to raise the £1 million that we were short. We were using some money from our reserves that we'd put aside to purchase helicopters, but we were £1 million short. So we had to put the campaign together in a really short period of time. We had 2 months effectively to raise that £1 million. We managed to raise the £1 million in 6 weeks because people just kept giving, even although we announced that we'd raised, we'd got there and we were buying the aircraft, people kept giving. And we're now up at £1.9 million, which is just off the scale phenomenal. And that speaks massively to the confidence and trust that our supporters and donors have, with us, and the relationship that we have with them. They know that we deliver a life-saving service. And we had the option for people to make comments when they made a donation. And we got hundreds of comments, from patients' relatives, from donors, supporters, volunteers, and just members of the public, saying how much they valued us, how much they appreciated us, and the quality of the service that we deliver for them. And many people's, the classic thing is we hope we never need you, but we know that if we do, that you'll be there for us or our family members. So that's really spoke volumes in terms of the trust that we have with them and the way people have responded. I think the way we presented the kind of almost the case for support was really important, because we didn't, we tried to, without overburdening or overcomplicating it, we tried to tell the story. We had to, explain to people that we had a challenge and there was a risk at one point that we wouldn't have been able to fly for a period of time, and that would have had a real impact on patients. We talked about the increased costs, and we talked about our way of offsetting these costs, and that we needed this extra £1 million to raise enough to buy the helicopter. So we were very open, we were very honest about that, and we explained what we needed people to do in the timescale that we had. And again, overwhelmed by the response. We got huge media coverage as well, which I think was really important, because that is an endorsement in itself, because the media are not going to come along and just say, please support this wonderful charity. We had a lot of pre-work with the media, and they were massively helpful, because we did a couple of briefings just before we launched so that they had the full story as well.
It's a really encouraging case study, backing up what you said at the very beginning about how important transparency is in underpinning those, because Absolutely. I think, I know a lot of charities are going through really challenging times right now, and it wouldn't surprise me to think that there's probably an instinct there to say, we just don't want to worry people. We don't want to sort of necessarily go out and say, look, we're in a bit of an unstable, at a bit of a challenging time. We don't want to worry potential donors and service users. But it sounds like kind of the use of language and the way that you told that story really did evoke a massively positive response from your donors, and being authentic about that journey was absolutely crucial.
Yeah, no, absolutely. And I think we apply that approach to everything that we do. We all have to make difficult decisions at times. The easy decisions are the kind of celebrations and when things go well, but we do all have challenges and we have difficult decisions to make. And a key question, probably the key question, is always, well, how do we communicate this? How do we talk to our staff about this? How do we explain this to our volunteers? Our trustees obviously are on board with these key decisions, but we have great sessions with them in terms of understanding the best way to approach things, and they're massively supportive. And then how do we sort of take that to the wider world, not just our current supporters, but potential new supporters? Because going back to the appeal, I think that there was over 14,000 donations. Half of these roughly were new donors, which is phenomenal in itself. So it wasn't just the existing supporters that we were reaching, it's people who hadn't supported us before, which again shows that the messaging and the story and the urgency, I guess the faith and the trust in us as a charity, that we were in need. We needed that extra £1 million, and that worked extremely well for us, and we're massively grateful for all the support that we received.
Yeah, it is a fantastic success story, and I'm sure there will be a number of people listening to this feeling quite envious about what you have been able to achieve. I wonder, is an air ambulance charity something of an easy sell from a fundraising perspective? Do you have any challenges in terms of building trust, particularly public trust, in what you do and the need to donate?
That's a really, really good question. And I think just going back to the initial point you made there, I think what's been really nice is a number of colleagues, highly experienced fundraising directors and chief execs have congratulated us, which is really nice, to get that from your peers as well. Air ambulances are, I think, not always an easy sell to the public. I think people don't necessarily understand that air ambulances are charities. So, we have to raise a total of about £20 million a year to deliver the service. And almost 90%, about 88% of that comes from public fundraising, which is a huge amount of money. Now, we think there's potential to do even more, because I think people still either don't realise that we're a charity or have the sense that we shouldn't be a charity, and the NHS should provide more funding. We get about £2 million a year through the NHS towards that, about 10%. And I think the third thing is people don't really understand what we do. I think there is a perception that we fly the helicopter to a patient who's either, broken a leg in a remote hillside or has been involved in a significant car accident or a sporting incident, and we just go to that patient and we take them to hospital. I think what people don't realise is the complexity of the work that we do, when effectively what we're doing is we've got on that aircraft, as well as the two pilots that are flying, a really sophisticated helicopter. And we've got a doctor and paramedic, and they're amongst the most experienced doctors and paramedics in emergency medicine in the country. And they effectively bring the emergency room to the patient. I don't know that people do fully understand what we do, and that makes the sell harder. And if I'm being completely honest, up until 6-7 years ago, I probably didn't fully understand what air ambulances do. And I had a visit with Yorkshire Air Ambulance when I was up in Leeds. And that really interested me, because it opened my eyes to what the air ambulances, what they do around the UK. And when the opportunity presented itself with Kent, Surrey, Sussex, it was too good to, not to apply for. And I'm lucky and privileged to be in the role.
So how are you working to raise public awareness and enough relevance to communities to ensure that you get the funding that you need from those public donors?
I think it's a constant, it's about trying to maintain that relevance on a day-to-day, week-to-week basis. I think for many people in many communities, they see the air ambulance arrive and then, they'll see it fly away, 15, 20 minutes later, and they wonder what's happened. And when we do land, quite often crowds gather to see what's going on. And I think people are naturally fascinated by emergency response, and they're also fascinated by helicopters. So that kind of brings attention, but do they really understand what we're doing, when you get into the detail of that? So we constantly try and raise that awareness at community level. What can we do that makes us relevant on a day-to-day basis? And that kind of links back to our overall strategy. We have a vision that ultimately we would like to see an end to preventable loss of life from medical emergency. So around the core service, what we also do is use the skills and experience that we've got to deliver education and training programs in the community. And that's something that we're going to develop significantly over the coming years. And a great example of that is last year around the sort of Restart a Heart week that the Resuscitation Council run. And we partnered up with that and delivered a series of webinars effectively showing people how to do CPR. And we reached in one day about 17,000 people, which is absolutely phenomenal. And we want to grow that. We'll do that again this year. Most of them were children, actually. A lot of it was through schools, which is even better, because every one of these children, every one of the people who learned CPR could be a lifesaver, and that makes a huge difference. We want to do a lot more of that. We want to do a lot more work with businesses and schools and community groups to teach people CPR and other life-saving skills, how to keep an airway open, how to stop a bleed, how to use a defibrillator. So there's lots and lots that we can do that will kind of build the relevance and build the awareness of what we do day to day. And that helps to drive fundraising. I think as well, it's just that whole network of stakeholders and ambassadors, volunteers who are constantly working really hard on a day-to-day basis, delivering talks and engaging with people, and just the fundamental or the key messages around we're a charity, how much money we need to raise, and the scope and complexity of what we do. It's just that drip, 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 always on. Hopefully the more media coverage we get helps as well. It's just constant awareness.
And of course, as you sort of said at the beginning, you want to go through life never needing an air ambulance. Yeah. But when you do need one, you really need one.
Yeah, you do.
They are essential.
Yeah, and that's the kind of one of our messages that, we hope you never need us, but if you do, we'll be there for you.
Can you tell us a little bit about how you make sure all of this is threaded through your internal operations as well? You briefly mentioned volunteers and ambassadors there, but what do you do to make sure that you've got really strong internal trust, as well as all this work you do facing out into the community? Because of course, an organisation where staff feel like they trust in what is happening and the direction, that's going to always just be huge for well-being, efficiencies, all the rest.
Absolutely. So I started with KSS just before COVID. So like 3 months into the job, COVID came along. So that kind of changed my initial thinking on how we would move forward. And as we had planned, we reviewed our strategy and developed the KSS way, which is our cultural and strategic framework. And the cultural piece was and remains really, really important to me and to everyone. We look at everyone as being part of the family, whether they're a member of staff, a volunteer, a fundraiser, a lottery player, everyone is part of the wider KSS family. And that's how we want them to feel. So there was a big process of consultation, not just to help inform us about how people saw the organisation developing, but what kind of an organisation did they want to be part of and what was important to them? Things like their well-being and the information and how we communicated with them and how we looked after people in difficult times like during COVID. And we got huge positive feedback. That was kind of being developed as we went through COVID. But we got huge positive feedback in terms of the impact of that approach. And we developed 5 core values and trust, being trusted, was absolutely fundamentally one of these values, but really, really important. We prioritise staff well-being, volunteer well-being. We want to look after everyone. We want people to feel that they enjoy coming to work, that they're supported at work. Everyone has challenges. Everyone has good days and bad days. We all do. I do. And you need that team of people around you. And I think we're really lucky in KSS that that's fundamental to the philosophy and the ethos of the organisation.
Going back to the external side of things and your identity and how you cultivate relationships with the communities that you serve as an air ambulance service, I can imagine that must be quite difficult because although you cover a specific regional area, it's actually a massive area, isn't it? 3 counties.
Yeah, massive geographical area, a population of 4.8 million and a transient population of about 90 million. People travelling through the region from the ferry ports and the Channel Tunnel and the airports like Gatwick and Heathrow and what have you. So it's a really, really busy area. I think it is, again, about making yourself relevant at community level. KSS in your community, what do we do to make a difference to a particular community? How do we engage with a group of people in a particular community? What impact do we have in that community? And it's building these relationships with businesses that cover the region, businesses that have a local footprint. At school level, it's really important, at community group level, and being visible in the community. And again, building that level of involvement through things like education and training initiatives, actually empowering people to make a difference, empowering people to make a life. Because ultimately, if any of us were walking down the road and we came across someone who'd collapsed, would we, 1, have the confidence to do what needs to be done, and 2, would we have the skills? And if we did have the confidence and skills, we would be able to hopefully save that person's life by performing CPR, by using a defibrillator, by stopping, a significant bleed if that was the emergency. And if we can keep that person alive for the kind of 5-10 minutes it takes for a doctor, a paramedic to arrive in an ambulance or for us to come along, then we've saved that person's life as much as the emergency services. And we talk a lot about that chain of survival. So it's helping people to understand the part that they play, as members of the community in being part of that wider emergency response to patients who find themselves in need.
But is it that much harder to show and demonstrate your local relevance than it might be if you were a much smaller charity covering a much smaller geographical area?
Yeah, I think it is, to be honest. I think it's not straightforward, because again, the air ambulance thankfully doesn't touch every family in the country, and people really only build up that relationship, that really strong relationship, if they are directly affected or touched by what we do. I think different charities have different challenges. Hospices are hospices are local, whereas we're regional. and they've got a much stronger, community footprint in a smaller space. And they have they obviously, again, they don't necessarily touch every patient in that community. Then there's organisations like the RNLI who've got a huge national footprint and don't necessarily, touch a vast percentage of the population. But what they do have, apart from the amazing work that they do through the volunteers and through the staff team, they have that presence in all the kind of coastal towns that's very visible. Cancer charities, whether you're like the charity I used to work for, the Beatson Cancer Charity at the Cancer Centre up in Scotland, one of the busiest in the UK. And they've got a great, loyal group of patients and families because of the treatment and the care that they give to their patients. But then Cancer Research UK or Macmillan, everyone is kind of affected by cancer, either directly or indirectly. So I think different charities have different challenges. Ours is not easy. We need to maintain that relevance on a day-to-day basis by being visible, by being present, and showing the breadth of the work that we do and the scope of the work that we do and how that makes a difference to people's lives at community level.
So as a final question, what are your top tips for other charity leaders who are seeking to strengthen the trust that people have for their charity, both internally and externally?
I think, in answer to that question in general, I often say it's about being brave and being confident and going with your gut feeling. And I think that applies to trust and transparency and honesty and openness. I think trust your instinct and be brave and don't be afraid. If you believe that the right thing to do is tell your supporters, if you believe the right thing to do is share this with your staff, then it's probably the right thing to do. If your gut feeling is telling you that it's not, then explore that and think about why that is and why you don't think it's something that you should be sharing at that particular moment in time. But I think be brave. Don't shy away from being open and transparent with people. I think, be brave in terms of share the challenges, share the things that don't go according to plan, because that's as much about building trust as, celebrating and sharing when things go really well. That for me is trust your instinct, be brave, and don't be afraid to share all of what's happening with the charity so that they really feel a part of it.
Brilliant. Well, David, it's been so great to have you on. Thank you very much for joining us.
Thank you so much.
Thank you.
Now we move on to Charity Changed My Life, in which we bring you the stories of people whose lives have been transformed for the better thanks to the work of charities. This week we hear from Helen, who joined the Rebound with Rovers football and mental health programme, which is laid on by the Bristol Rovers Community Trust.
I was having therapy and my therapist had handed me a leaflet and it was to do with Rebound with Rovers. It said the day and when it starts and stuff like that. I just went along. It was quite daunting because new things, I'm a bit wary. All I could see was Costa, who runs it, and he was there with another chap from the Gloucestershire FA. And I think I was about there for 10 minutes. And I thought, do I just turn on my car engine and out the car park I go? But I thought, I'm here now, and that was it. I haven't looked back. First hour is football related, so a bit of physical exercise. And then the second part is just to come in for a chat, bit of a social. And yeah, it's just get yourself out and socialise and relax. I'm sure it's about 3 years now that it all started. After about a year of being there, Costa asked if I would be interested in sort of assisting him with coaching. I thought, yeah, it's a challenge, and it just makes me feel part of something. I still get my bad days, I get my low days, but knowing that I've got Rebound with Rovers to go to on a Wednesday, I just look forward to going, and I could be at my lowest, but I turn up, and it's just that fun feel. You can have a laugh and a joke with the other participants, and for those 2 hours out of your day, it's just good. And to know that you're helping other people as well, that maybe in the same situation or different situation to you, but they're actually come in and they feel good about it. And it certainly helped me feel better. I'm in a happier place, knowing that you're not being judged or anything like that. You're just having fun. You're kicking a ball having a laugh, and that's what it should be all about.
That was Helen telling us about how her involvement with the Bristol Rovers Rebound with Rovers mental health programme has changed her life for the better. And if you'd like your organisation to be featured in Charity Changed My Life, we'd love to hear from you. All it takes is a short voice message from someone who has benefited from your services. You can find details of how to get in touch with me in the show notes to this episode.
That's it for this week. And we'll be back next week for a live recording at the Third Sector Conference, where we're going to be joined by Rodri Davis to dig deeper into some of the themes covered in our recent and very popular podcast documentary, The End of Charity.
And just before we leave you, a quick call to action. If you're enjoying the Third Sector podcast, please follow the show on your podcast platform and leave us a rating. You can also get in touch with us directly to provide your feedback via the short listener survey, which you can access via the show notes to this episode. But for now, thank you to our guest, David Welch, and our producer, Nav Powell.